Hi, welcome to Facebook Live today. We're kicking off day one of Women's Health Week. It's obviously just the beginning of lots of different topics this week. We've got lots of different events. We also have a lot of material online, and we have quizzes and podcasts, Facebook Live videos. So today we're starting off our topics with, so it's called silent topics, the issues that we often don't like to talk about. So joining us for that is Gene Health's very own medical director, Dr. Elizabeth Farrell, or Liz as we all fondly call you in the office. And Liz is our foremost expert in a lot of these areas. So we thought it'd be great for Liz to come along, have a chat to us about some of the topics that you find when your lovely patients come to see you. What is it that you find they don't like to talk about as much?
Well, I think there are three areas I want to briefly touch on today. That is periods, period pain, and itchy vulvas, and the topic that we don't like to talk about down there. And what I would like to say is that Gene House has this fabulous vulval booklet, and if you go online and have a read of that, you'll learn all about itchy vulvas. And basically, an itchy vulva, most people think it's thrush or candida, but in fact there are many other reasons for itchy vulvas. And probably one of the most common ones is that you scrub down there with the old soap. So soap is a no-no. Plain old water or a soap substitute. Most people go to the chemist, get something for it, usually a thrush cream or something, and then they find it doesn't work. You need to go to your GP and find out exactly what's going on around your vulva, why it's itchy, and you need to be examined. Many GPs don't want to look down there, but in fact we should be very au fait with what our vulva looks like. And we all have our own unique vulva. None of us have two vulvas the same. In fact, one side's always a bit different from the other. But important that if you do have some treatment that you get from the chemist and it's not working, please go and see your GP and have a read of this fabulous book.
Do you find, Liz, that often patients will come to you after a while with symptoms around itchy vulva, like they'll try to self-administer something and then later think, oh, like this doesn't...
Because most people think that the main reason for having an itch around your vulva is, in fact, it's got to be candida, it's got to be thrush, it's got to be a yeast infection. Excuse me. Whereas in many cases, it's not. And it depends on what could else be happening when it's going on. So I think that if it's not settling down, don't scrub it. Just treat your vulva like a baby's bottom, very gently. It doesn't need a scrubbing brush, doesn't need lots of soap, doesn't need any of the antibiotic soaps or anything like that.
That's actually good. Baby's bottom. Oh, that's we can all remember that. So, Liz, what are some of the other things that women come to you about?
Well, I think heavy periods is one of the other issues that I think we need to talk about, because many women have heavy periods and they perhaps get used to having heavy periods and they don't quite realise that they're heavy and they're causing other issues, like they're becoming iron deficient or that sort of thing. So I think it's important for women to be aware of, if somebody's changing it, a large tampon or a pad every hour or so, then that's a reasonably heavy period. And I think that it's one of the major causes of iron deficiency in the Western world, but in the third world, it's probably one of the major causes of chronic anemia. So it can cause tiredness, and even having low iron stores can cause quite severe tiredness. So women who've got heavy periods really can have medications to help. They're not necessarily even hormone medication, but there are some medications that can help reduce the flow so that their iron stores and their iron levels are within the normal range. And I think that's one of the important things. And of course, it leads on to the fact that sometimes a change in menstrual cycle can actually mean that there's something else going on inside the uterine lining. So sometimes if women have bleeding between the periods, or they have bleeding after intercourse, after sex, that may mean that there's something else happening. Or the periods suddenly get heavier. So there might be things like polyps, which are like thickening of the lining in like almost like a teardrop, a big teardrop. Or there might be fibroids, which are bulging into the lining of the uterus, and so that can cause heavy bleeding because it often has big blood vessels over it, and they break open and rupture when the period's happening. So there are all sorts of reasons for having heavy periods. And at different times, particularly towards the end of our reproductive years, we also have to be very careful about these very heavy periods causing thickening of the lining, and very rarely that can be a uterine cancer. So heavy periods do need to be talked about and thought about. And that really goes on to our third topic, and that is about period pain. And, I've said it so many times, and you've heard me say it so many times, period pain that impacts on you functioning normally is not normal. And we need to sort that out. So young adolescents who have period pain right from the beginning, they might have period pain that will settle down with time, but they may not. And if period pain is stopping women working, studying, or going to school, then they should go and see their GP and have it sorted out. We know that one of the areas that we're very interested in is endometriosis. And we have a number of booklets and things that you can read. So we've got a little brochure on My Period, which is about looking at what your periods, what's normal, keeping a diary and looking at the frequency of it and checking about what's really happening. And we also have a symptom diary, which is very handy to have, and it acknowledges what's happening to you.
It's easy to fill in.
You can fill it in and you can score it. And it also makes you say, look, this is what's happening. And often you can, if it's really troublesome, then take it with you to see the GP. And we also have a little booklet on understanding endometriosis. Now, everyone who has period pain doesn't have endometriosis, but in fact, when period pain is continuous and it happens all the time, each cycle, then it's very important to make sure that this isn't one of the causes of the period pain.
So Liz, perhaps you could tell us a little bit more about endometriosis, or endo as it's called. And as you say, and as we always emphasise, just because you have a few of these symptoms doesn't mean you necessarily have this condition by any means. But endo is a really big part of our campaign this year in Women's Health Week. And we're also introducing a new big campaign next week on endometriosis, which you'll see throughout our website during the week. But Liz, perhaps if you could tell us a bit about endo.
So women who have endometriosis have lining cells. The lining cells that we shed when we have a period not only come out through our vagina and onto a pad or tampon, but they can also go through along our tubes and inside our belly. And women who have endometriosis, those cells seem to behave differently from those women who don't have endometriosis. So if women who don't have endometriosis have some flow of those cells inside their belly, those cells will just get mopped up by cells that destroy other cells in the body and they disappear. But in those women who have endometriosis, these lining cells can stick onto tissues inside our pelvis. So they can stick onto what's called the lining, which is the peritoneum, can stick onto the ovaries, onto different ligaments, and they will start growing and having the same cyclic symptoms that our periods do, our lining of our uterus does, so that when we have a period, these little cells will multiply and they will shed, they will bleed as well. And over a long period of time, they can cause little nodules, or they can sort of push into the ovary and cause big cysts, or they may just have little spots everywhere around on the lining. And obviously there are degrees of endometriosis, and they can actually cause pain. Some people have no pain and have endometriosis. Other people have severe pain and have endometriosis. So at the moment, there are no cures, but the best way is to have the endometriosis excised, and then to have certain treatments to maintain good health, whether it be stopping any further pain or stopping any further bleeding, and to maintain a healthy life through those and management of pain and things.
And I guess a message that we keep mentioning again and again at Jean Hales is, if in doubt, go see your trusted health professional. Go to your doctor, go to even speak to a nurse, whoever it is that you trust who's a health professional, to start going on that road. You're not alone, and there's a whole host of professionals out there who can help.
And read as much information from appropriate websites such as our website about the conditions that you've got, whether it be an itchy vulva, whether it be periods, or whether it be period pain.
So any more information on anything we've discussed today is on the Jean Hales website, jeanhales.org.au. But also all this week, as you know, we're celebrating Women's Health Week, womenshealthweek.com.au. Please stay tuned. Every day we have new content, new material that is sure to reach a broad range of people and a broad range of interests. So thanks so much for joining us today. Thank you very much, Liz.
Pleasure.
And
wish everyone a very happy Women's Health Week.
Thank you.